There are thousands of mold species. Most molds and mold spores are harmless to humans. When we breathe them in, our immune systems eliminate them before they do any damage. But in some cases, inhaled spores can make people sick, especially people with allergies or compromised immune systems. Whether a specific mold has a harmful effect on human health depends on the type of mold present, as well as the amount of exposure and susceptibility of the individual. Someone with asthma, for example, is more likely to suffer harmful effects as a result of contact with a specific mold or mold spores than someone who does not. Physical symptoms related to mold exposure usually affect the respiratory system. Affected people may feel flu-like symptoms that persist as long as the exposure. Symptoms include nasal stuffiness, eye irritation, or wheezing. Once the offending mold is removed or reduced, symptoms usually disappear. It's important to remember, though, that most people will suffer only minor effects of mold exposure, if at all. It's primarily asthmatics or people with other pre-existing respiratory problems that are affected. Other people that are heavily exposed to mold, such as farmers working around moldy hay, are most at risk. For these people, symptoms can also include fever and shortness of breath. Also, not all air quality problems are the result of mold infestation. Many other factors, such as poor ventilation or airborne viruses and bacteria, also affect employee health.